So I'm doing new patient exams today, and young Shaq has come in with a very narrow palate, but I want to explain why this palate is the way it is, right? A couple of things. Open nice and wide. If you look at the scalloping of this young man's tongue, you can see the lateral borders of the tongue have that outline of the teeth, which is what one of the causes is of airway problems and OSA. The other problem is the tongue tie. Can I get you to try and lift your tongue up here? Can you see how he can't lift his tongue up to the palatine rugae? And that is quite a bad tongue tie, which would need release. And the last thing is the size of this young man's tonsils. Can I get you to open really wide, say R, so you can see that Mallampati index? When he just say R, big R. When he says R, you look at the opening, and he's like a Mallampati 4. If you look at his tonsils, they're like a grade 3. So Mallampati 4, tonsils grade 3, scalloping of the tongue, tongue tie. Now we have a cross bite. Just bite together again. So you can see on this side, we have the molar and premolar in cross bite to the lower. And that's causing a functional shift of the mandible. There's the upper center line, there's the lower center line. When this young man chews, it's causing the jaw to deviate to one side. So the ideal treatment here is to possibly work with an ear, nose and throat doctor, widen the palate, maybe reduce the size of those tonsils, and they get the functional occlusion to where it fits. That would also help this young man with his sleep pattern and sleep disordered breathing problems.